Greetings and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowikci from Windham District of Putney, Dummerston, and Westminster. This is a post-legislative session edition, and today I am joined by our two Windham County Senators. Welcome, Becca.
Thank you.
Senator Becca Ballant and Senator Jeanette White. It's been a little time to digest what happened in the session, and what I was thinking is to start chronologically with some things that happened even before the session began. The budget was an overriding influence on just about everything that went down in the session, and before we came into the session we were told we've got quite a budget gap. Revenue projections were off, the economy was moving a little slower than we had, and even with a great unemployment rate, which is down under 4% now, I believe, things weren't matching up. So that was a big cloud over the whole session, really. And then the other thing that happened in December, that Governor Shumlin decided that the single-payer project wasn't going to work and pulled the plug on that, or put it on the back burner. And I think a lot of us are still thinking that, as Senator Sanders has been saying, Medicare for all is still the way to go. And a single payer is the way to go, and we can talk about that a little later. The budget, how did that affect the work you're on and the committees you worked on? You worked on two in the Senate. Which ones were they?
So Economic Development was my morning committee, and Institutions in the afternoon, and certainly was something that we heard from the very first moment that we walked in committee. We had a lot of projects that we wanted to get off the ground, and all of that, of course, had to be tempered with the fact that there was a $113 million budget gap. And as a new person coming in, I think for me that was the norm, because I've never known anything else, but everyone kept saying what we're wrestling with is really unprecedented. And so I was very well aware of the frustrations of those folks who've been on the committee and felt like we had made some gains in particular areas, and we're going to have to ratchet back because the money just wasn't there. So that was definitely how it impacted in those first few days and trying to get a vision for economic development.
And your two committees, Jeanette?
Judiciary in the morning, and then in the afternoon I chair government operations. Yeah. And the Judiciary Committee was faced with a lot of issues around the budget, because part of the cuts that were going to take place were in the judiciary. And there are some things that you just can't keep skimping on. And I think that justice is one of them, and people's access to justice has got to be treated seriously. So that was a huge impact on our committee. And it would have hit Windham County a little harder too, with two retiring judges.
Right. The vacancy savings.
Right.
Absolutely.
Well, we already have some of those.
Exactly.
And to have more of them would have just been too much. And then in government operations, a lot of the things that we do aren't budget driven, because they deal with open meeting and public records and elections and stuff. But some of the things that we deal with, the operation of government, I mean, really we can look at almost anything that's structural. So we started looking at a lot of kind of structural changes, and you don't make those changes in 1 year. We had fewer one-time savings that we thought we could achieve. We did some by I think we're going to require, something really that sounds very simple is different agencies and different departments around the state have their own little Pitney Bowes machines that they run through. That costs a lot of money for everybody to have one of those, and that should all go through the mailing service in Middlesex. So we did some things like that should have some savings, but of course they won't take effect until later on. But then we're looking at some structural changes, and we'll keep looking at that.
And you've been part of a committee for a while now, looking at how we can more streamline government, isn't that so?
The Government Accountability Committee, we're doing more results-based accounting and budgeting by results-based. So looking at what is effective and what should we be funding. I was on the committee when it first started. Oh man, that was a long time ago. But and then I was off it for a while, but I guess I got reappointed this year. So I'm back on. But I think that if we can continue to do it, our funding or our budgeting that way, I think it'll make some.
Yeah, I mean, Human Services has done it since Con Hogan was at AHS, and now they're trying to have all of our government operations use results-based accountability. For those who don't know what RBA stands for, and I think it makes sense.
And I think that Human Services, the agency was doing it, but they weren't doing it across the board, and they weren't really doing it with enough attention to detail. Because if you're going to do this, you've got to really figure out what are your goals, what are your objectives, how are you going to meet those, what kinds of data are you going to collect so that you know whether you're meeting your goals or not, and whether you're being effective. Right. And I don't think that they'd been doing that. When we first started this a number of years ago, the person who was the Commissioner of Buildings and General Services at the time came in to my committee, because I was on institutions then, and he came in and he said, you know, our budget, the way our budget process works, it says you have to do this. You have to say, what are your goals? What are you going to get out of it? But nobody ever does it. And he didn't know that nobody did it. So his first year, he had done this great thing. And he said, but nobody wants to hear it. The Appropriations Committee doesn't want to hear it. They don't. So he came in and did a presentation to government operations. And that's when we when we told people that they had to use the fleet cars. Yeah. I mean, that was one of the things that he felt we could save money on.
Yeah, it makes sense. Anybody that's worked in a nonprofit and writes grants, that's the way you have to do it, so it makes sense.
One thing that I wanted to say as Jeanette was talking, it reminded me the extent to which in institutions, the chair of institutions was working really carefully throughout the session with the chair of appropriations on the Senate side to try to figure out this judiciary funding piece. And I know there were some fee increases that they felt like hadn't increased in several decades in some instances, and no one wants to see fee increases for people that are not able to afford them, but to just bring them up to the other fee schedules, some of the other agencies and departments. But the interesting thing for us, we had talked before we were on the air about the Health Connect issues and how that really colored a lot of the conversation around healthcare, but it also colored the conversation around technology. But one of the things that we came to on institutions was that we really felt strongly that we wanted to fund the technology piece for the judiciary, because we're asking them to do more with less. And if we can get them really in this century in terms of how they can file their dockets, it will be a tremendous help. So I felt really glad that we were able to help make that happen.
Well, we have your comment about technology is we have this really bizarre setup that there is no committee that has authority or responsibility for technology
or knowledge.
In the state. And we talked about it, and in the House they assigned it to government operations. Okay. I mean, it is an operation of the government, but Senator Flory and I had a lot of conversations about this, because the money for the technology is part of the institution's budget. So if you're going to have the money for it there, it makes sense to have the oversight there too. I mean, it just doesn't make any sense to have it. So we haven't changed our rules, but it's kind of an understanding that the Institutions Committee will be responsible for the oversight of the technology projects, because there are billions and billions of dollars of them in the wings.
Yeah. That may be a good segue to the Economic Development Bill, because wasn't there something in that seats a committee to overlook IT?
Yes, and the interesting thing about the oversight piece as well, I just want to say, is that I really believe that for the first time in our process in institutions, the chair was saying to folks as they came to make their presentations, we need to know not just how much the initial setup is going to be, but what is going to be the administrative costs moving forward for all the updates, because that's where the huge cost is over time. And so it's a change of thinking about these expenditures, that they are ongoing, and you have to know what you're actually getting to be able to talk to the committee about what the taxpayers are getting. And that was a little bit, I think, of a breakdown, that the assumption was we can talk about it in more general terms and not specific terms, and that's how,
Well, I think that's because there was no committee that had oversight over it.
Exactly.
Institutions had oversight over just spending the money and buying the systems, but nobody had real oversight over it. So hopefully that'll get better.
Yeah.
This was the first year we've done that.
So you were on the committee that put together, I think, a really comprehensive economic development package this year. You want to share with the viewers a little bit about what we're hoping to do and hope that bill will accomplish?
One of the things that really bubbled up very early in the session was this notion that as a place to do business, Vermont hasn't done a great job recently of really talking about what we have to offer businesses and entrepreneurs. And we have been more geared towards spending money on attracting tourist dollars, which is also important. And we're a beautiful place to live and play. And this idea of expanding our notion of Vermont as a great place to work as well. And the Lieutenant Governor had sponsored a series of economic pitches. I think we probably were all there at the beginning of the session when he had his first one at the Capitol Plaza. And that resonated with a lot of lawmakers. And the trick is, how do you encourage the agency of commerce to expand their idea of what we're marketing without being too directive? Like, is it really the job of the legislature to say, this is what the marketing program should look like, this is what we should call it? And there was some disagreement between the two committees on the House and the Senate side. And in the end, though, I feel like we made some really good headway in all agreeing that we need to spend some money and some time and energy in that arena. And there isn't a lot, as we started at the top of the hour here talking about, but just having that new focus that the folks at Agency of Commerce are really going to be thinking about those dollars, not just in terms of attracting tourism, but attracting new workers here, because it's a huge problem for all of us here in Windham County. And I was just at an advanced manufacturing report rollout the other day. It's across the state. We're really hurting for particular workers in some of our higher tech industries and some of our advanced manufacturing. So we've got to find a way to get those workers here and keep them here. And
I was at a training with some legislators from around the country, and somebody from Minnesota, your home state, said Minnesota is taking a lead from what Canada does, and they do targeted immigration. For if they have somebody coming, an industry coming in where they'll look around the world to target people, to invite them to come here. I wonder if that's something that has ever been considered here.
Yeah, well, we know that, and we've talked about this with Curtis Reed through his wonderful program that he sponsors every year, about thinking about the issues of multiculturalism, not just in terms of acceptance, but really looking long-term at the future and health of our economy in Vermont. We know that most new workers in the next several decades are going to be people of color or people of mixed race, just in terms of the demographics. And so we as a state and as communities need to make sure that we're being proactive and we're making our communities a place where people feel welcome, regardless of cultural background. So it absolutely ties in. And we have the Champlain Chamber is doing some targeted work, not necessarily for workers from Quebec, but trying to attract more business from Quebec to come to Vermont. So I think we are changing our focus there. We need to get more creative and nimble because we're all competing for the same workers.
It seems to me that one of the things we have to do too, though, is not try and compete for bringing companies into Vermont.
Absolutely,
because if
we don't have the
resources to do it, and if you lure somebody in when somebody else has a better offer, they have no commitment to here. And what we need to do is we need to spend a lot of time and effort, I think, building the entrepreneurs that are here, the small
Exactly,
businesses,
yeah.
helping them grow so that instead of 3 employees, they can have 10 or
Right.
12.
Absolutely.
I mean, I think the days of getting people to come here to do their
Well, I think New
businesses
York's
are-
finding out, or there's some research showing that New York has made a big push for that and made big offers to new businesses. And one of the things it does is it kind of ticks off businesses that are there. And there was an article in the Times that says it's not as effective as they want you to believe it is anyhow. And I think what you're saying is right on.
Well, I was on the Community Development Board for 13 years, and one of the things that we saw was not only that happening from state to state, but from town to town within Vermont.
Yes.
So some town in Vermont applies for a CDB, Community Development
Sure.
Block Grant, and lures the company that's in their neighboring town over here because they'll.
Right. We talked about
not-
that on our,
it just-
our committee. It's not the environment we want to foster
It's
at all.
not,
and
yeah.
and I had a great meeting last week with the guys from Sion here in Brattleboro, Jonathan Morris, Guy Payne, a couple other people in the room, to tie into what we've been doing on the workforce committee at CEVEDS, which is this exact thing. How do we build relationships with the schools, with industry, with those people supporting them to grow entrepreneurs here? People who already know they want to be here, their families are
Yeah.
here. Because, I mean, look at, perfect example, Against the Grain.
Yeah.
They were here, that business has taken off much more quickly than anyone imagined it would. And we have other examples of that, but they were here.
Right.
We didn't lure them in, you know.
Right, right, and that's- yeah,
yes,
yeah,
and
yeah.
and then they feel a sense of, as you said, responsibility to the community.
Right, and this is where their heart is, and
Right. No,
One of the
I
things the
think-
governor's been
yeah.
pushing, though, and I agree with, is that the green economy is the place to look as well. And I get some pushback from people in our traditional industries feeling somewhat ignored. Did you have that sense, encounter that at all during that there's a push and pull as to where economic incentives should go? And I think the governor was right up front that with you know a green energy industry, that a lot of room for growth there.
Right. I mean, I think our conversations pretty much across the board centered on the fact that we need to do economic development the way that we do agriculture well in Vermont, in terms of it needs to be diversified. There's a place for advanced manufacturing. There's a place for value-added food growth. I mean, that's a huge part of our economy. I educated myself about the extent to which value-added with our milk products as well is you know, a tremendous part of our not just our agricultural history, but our economy today. And so I hear that not so much when I'm up in Montpelier doing that work, but when I'm here home, I had my tires changed and was talking to my mechanic about, you know, his really bemoaning the loss of advanced manufacturing jobs here. But that's something that we also are working on. We know that those are good middle-class jobs. They are the backbone of the community in terms of, you know, who's buying things within the community. So I just keep talking about a place for all. It has to be a diversified economy. You know, those places that have their economy pinned to one big employer.
Yeah.
I mean, look at Rutland. Rutland is
Springfield.
Springfield, right? So they, you know, GE is a fabulous employer in Rutland, and I've toured the plant. It's incredible what they're doing there, but they hold their breath
Yeah.
all the time. What happens if they leave?
Essex.
Right. So that's not. We don't want to be in that situation in Windham County, or
No.
you know, or anywhere
Or in the state.
But in terms of, you know, thinking about what's right for us here.
Any good business plan is diversified. You
Absolutely.
want multiple funding streams, and that
Exactly.
way you're not left high and dry.
Yeah.
You lose one customer.
Yeah.
Yeah. Jeanette, your morning committee was judiciary?
Yes.
Yeah. And you had some pretty tough things to work on, even before the session started. Unfortunately, there were some horrible headlines about we lost a couple of children. And the work on the child protection bill started even before the session started. So when the session began in January, you were ready to go. Can you talk a little bit about that bill and the process?
Sure. First of all, I should say that, in my opinion, whenever we do legislation in response to an incident, we do it wrong. We don't get it right because what we've done is we've focused on that incident, and I
It's
think
hard to
that's-
get clarity and big picture
Yep,
when
I
you're...
think it's the
yeah.
wrong way to do it. So this bill started out much different than it ended up.
Yeah.
And it started out really being in response to those two incidences. And I think that we took a ton of testimony. And I think that as a result, what came out of it was kind of a strengthening of the communications and the working together, the collaboration of the different agencies and the different organizations that deal with children and protecting children. So you have Department of Children and Families, law enforcement, the courts, all the schools.
And that was a sea change. That was such
was-
an important
yeah.
piece of it.
Yeah.
You know, even if the bill doesn't work, which we
No,
hope it does, but getting those people connected in a different way
Well,
was
and I
huge.
think that telling them that they have to connect in that way, which is what the bill
Right.
primarily does.
Right.
I mean, it does some other things too, but I think that was one of the big things that came out of there. It was a very, as you can imagine, emotional issue, and Dick Sears he's the chair of the committee. He's from Bennington, and he made sure we kept right on the straight and narrow. Lost it a few times, but we all do that.
Yeah. And then when the bill went to the House, it took a little different direction in terms of moving away from the new law that was suggested.
Well, the new crime that was
Right.
created,
Right. Yeah.
which
The
was,
new, yeah.
and there was a lot of controversy around that, and what ended up being created was less than what had originally been planned, and I actually think that the creation of that new crime was not a terrible thing the way it ended up, because if you look, it is so narrow. It is. I mean, we heard from people that said, I'm going to fall under this crime if I spank my children. Not true. Not true. First of all, you had to know that the abuse was taking place. Secondly, you were in a position to be able to do something about it, which would have immediately not affected people who were the victims of abuse themselves. And you had to know that your taking an action would have stopped the abuse, and you didn't do it. So you had to meet all four of those things, and then the result had to be that a child was either seriously bodily harmed or caused death. So it was so narrow. And I understand that people still felt that it was going to be misused by really aggressive state's attorneys. We have all elected state's attorneys in the state, and they interpret things differently according to the area where they live. So,
Right.
so that isn't in there anymore, and it's still a good bill.
Yeah. Is this the alpha and the omega around this, or is this something we need to keep going back to and keeping track of? I mean, the legislature
don't think
plays a role in oversight here.
There is there was a creation of a new oversight committee that, when it first was set up, it was going to be a committee to oversee the Department of Children and Family, which didn't make any sense to us. So our government we actually had 3 committees work on this. The Health and Welfare did it, Judiciary did it, and Government Operations looked at the creation of the Oversight Committee and the creation of the Office of Child Advocate. So the committee, the Oversight Committee, will have oversight over the system of child care and system of child protection. So it'll include all those organizations that we talked about earlier, instead of just focusing on DCF.
Yeah.
So, and I think that's good.
Yeah. One of the figures that really stands out, last year, the state took into custody 80 babies, and 80% of them were because of addiction. And even in a tough budget year, I give the governor credit here, because the the AHS budget was actually up. And those, the areas it was up were for mental health services and addiction services. And I think going back to a number of the problems we're facing in our society, the roots are in addiction and mental health. So I think whether it's homelessness, addiction, crime that is drug-related, we need those services on the ground, and that's where I think the governor is continuing to push for that. Now, segueing again into that issue, because I think it touches so many parts of our budget, from corrections. You've had some experiences lately with what's happening locally?
Yeah, it's been really interesting. There have been two topics that a lot of people have stopped me to talk about on the street in Brattleboro since I've been back. The first one was the Consumer Protections Bill, which Byron Stuckey locally and a lot of folks at SEVCA had worked on for a very long time, and folks at Legal Aid. So that was what a relief.
The rent-to-own?
It's a rent-to-own. It has some other consumer protections in it, but most folks know it as the rent-to-own. The other thing that people have stopped me repeatedly to say is we have to talk about our opioid problem in this county. And from teachers, counselors, just friends on the street, people who are noticing more theft, more rates of homelessness with kids, kids living in cars. And my kids go to the public schools here in Brattleboro, and counselors have pulled me aside to say, we've got to get a handle on this that's impacting us in so many ways that we never anticipated. So I just now, before coming here, was at a meeting at Turning Point, and it was a meeting with folks from the hospital, people who are at their treat, people who work in prevention, and I had heard about it through Robin Reski, who works for the state, because she had I wrote an op-ed about it last week, and so she invited me. And one of the things that Rebecca Jones was talking about, another doctor, the other doctor was from the retreat, was this issue of overprescribing and that of opioids. And you were talking about having just had eye surgery, and you were offered Percocet, and that still happens more than we think it does. That we have to really bring the medical community on board to say, this is for many people where it starts. And one of those conversations that needs to happen is to ask your patient, are you in recovery? Because there was a man there in the group sharing with us, and he said he had gone in for a surgery too, and he was offered opioids, and he said to his doctor, I'm in recovery, I don't think this is a good idea. And the doctor said, just take it as prescribed and you'll be fine. And so many of the people who work in prevention and in counseling and said that they know so many people locally for whom that was, once again, the thing that pulled them back in to losing control of their addiction. And so that was a piece of the puzzle. We certainly had heard about young people raiding their parents' medicine cabinet and people selling their opioids on the street, and then that being a slippery slope to heroin, but I hadn't considered this, that it's still a problem. And how do we get that word out to the medical community that it is not something to take lightly? That of course you don't want someone in pain. You don't want someone at the end of life to deny that palliative care and whatever form it takes, but we cannot be so cavalier. So,
and I think what we've seen too is people starting with legal prescriptions, and then when that runs out, I mean, they're addicted. And people in recovery will say, in terms of someone who's an alcoholic, 100 drinks isn't enough and one's too many. And the same is true with the prescription drugs. It's a quick walk across the block, across the street for heroin, because heroin seems to be so prevalent and it's everywhere in the country, and especially even in Vermont. Yeah,
and the other piece that I've been mulling over since I left that meeting and driving over here is we also have this conundrum, because the Suboxone is a wonderful means of helping people deal with their addiction. It works for many people, and it is also being used by young people. You can cut it you can sell it, you
Mixed
can
with
ingest,
other-
you can mix it with other things. There aren't as many horrible side effects, and so again, it is meant to do good. It does do good. We don't want to restrict access to it for those people who need it. And how do you balance the unintended consequence that you certainly don't want that to be the next thing that people are abusing? So it is. I talked about it in my column, like just a many-headed dog, and you deal with one head, and then you realize, oh, there's this other piece I hadn't considered. So it's interesting too, the different perspectives people have on it. So many people in the room felt like we cannot stop talking about addiction or even starting to use illegal drugs as a choice, because you may start as someone who gets a prescription in the hospital. And also, what does that mean in terms of choice if you have a family history of addiction, all that?
One of those strategies is at the root of the rapid intervention programs that are happening
Yes,
in
I'm
Springfield.
very interested in that. Yeah.
And they call it the blue light moment. Is when some people get the realization that I've got to change my behavior, and many people choose the option of recovery and treatment, or going into the judicial system, and they've got some good outcomes. I think there's the Sparrow program in Springfield, and I forget what they call it, but T.J. Donovan in Chittenden County has a program going. And I think, again, in a comprehensive approach, these have to be tools that we expand. And I think we would have this year if there had been some money, but the challenge is that, how do we keep the budget on track?
Well, I think it's up to the state's attorneys, the individual state's attorneys, to do it, and I think more of them. There is one that's just kind of getting off the ground in Windham County. Tracy Schreiber has set that up, and there is I don't think they have it yet in White River Junction, but so different state's attorneys have to agree to do it, and then they have to agree to get the law enforcement community to agree to it. And
is this something you looked at in judiciary?
yeah, we
this
passed
year?
it 2 years ago. No, 2 years ago we passed
Okay.
it. It became effective. I can't remember even when it became effective, but it takes a while to set up the programs. I think it became effective last July that you could do the it's called risk assessment and something. And there's it's pre-arraignment and pre-trial. There's 2 different levels of it, and they're done for different reasons. Risk of flight, treatment versus incarceration, all of those. So we spent a lot of time on it.
Now, you mentioned Turning Point. It's our local recovery center. They're in their new building now?
Yes, they are.
I haven't been in there.
It's lovely.
Oh, good.
They did a really nice job. And of course, there's still some work being done on it, but I was so pleased with what a calming space it is. And
good.
and
And
I
it's
had
an essential part.
absolutely.
Yeah.
As people are in recovery, it's a lifestyle.
Yeah.
Many people have to continue with peer support, 12 steps, as long as they want to walk upright. And it's essential to have these recovery centers.
Absolutely, and what a great space in which to pull all these different people together. We didn't have someone specifically from the housing community in the room. Some folks had been invited, but of course, as you know, it's impossible to get everybody in the room. But the issue of what do you do with those folks who basically on paper are unrentable? Like, you cannot rent them an apartment. If you simply go on what their past history is, how many times they defaulted, and yet we believe, most of us, in a housing first model, and that we are making headway there. And so I feel like there's great conversations happening, and people are really starting to look at the ways in which you can't deal with addiction unless somebody has a safe place to be. Yeah.
One of the challenges there is Vermont and Brattleboro and Burlington have such low vacancy rates.
Absolutely.
In other states, what they'll focus on is unused housing. It just isn't
Doesn't
happening
exist.
in Brattleboro,
Right.
and that's where I think at some point a federal-state collaboration hopefully can create some more housing.
Yeah.
Something else came out of your committee this year that was controversial, to say the least. And
almost everything that happens up there is controversial.
Well, it
to
can
some
be,
people.
but
Even things you think might not be. Yeah.
at the start of the session, there was a lot of energy, especially emanating from Brattleboro and from Ann Braden and Gun Sense, that we needed to take a look and bring our public safety laws around guns into the 21st century. Your committee did a lot of work.
We did a ton of
There was a point in time where they thought no way this was going to pass, and then you pulled something out. You want to talk a little bit about that process?
Well, it was again a very emotional issue, and the worst part of it, I believe, is that there was a lot of misunderstanding about what it was, and the part that some people thought was the core of the whole bill, the universal background check, did not make it into the final bill. That was not going to get passed out. It was just very clear. So we focused on the two other parts of it, and one is reporting people who are, and it isn't just people with mental health issues.
That's right.
You have to be adjudicated by a court to be a person in need of treatment. That means you're a person who is a danger to yourself or others. Very, very, it isn't just
very
people
narrow.
who are depressed. And we took a lot of testimony to get that exactly right. And then as soon as you're deemed by the Department of Mental Health to not be a person in need of treatment anymore, you can apply for your gun rights back. So that's one part of it. And the other part is giving our state's attorneys the ability to enforce gun legislation. We didn't create any new laws at all. Currently, if you're a convicted felon, according to the federal definition, which is very broad, it's anybody who's been convicted of something that requires a year or more of jail time. That's very broad.
Right, includes a lot of nonviolent.
It's anybody, it's over a year. So that's how they define felony. So we didn't want that, we didn't do that. So instead we've defined, and it's the big crimes. It's what's called the listed crimes. So it's violent crimes. And all we've done, it's already illegal to have a firearm if you're in that category. Federally, it's against the law. But because we don't have a parallel state law, our state's attorneys can't enforce it. So only the federal attorneys can enforce it. And they're not going to monkey around with small cases. They're going to go for the big ones and big drug dealers and stuff. So this just gives our state's attorneys the ability to enforce what's already a law, but it's very narrowly defined. And we looked at every single one of those listed crimes, and we pulled some of them out because they had no relation to firearms. Now, some people thought we were wrong, but for example, if DUI, even DUI with death resulting, that has nothing to do with a firearm. You can still have a firearm. You might lose other rights, probably, but you don't automatically lose your right to a firearm.
Yeah, it was difficult to get beyond the rhetoric, and I know I had a lot of conversations with voters, and often it would start, if I knew it was someone who was against the proposed bill, it would start with sort of
my Second Amendment rights.
And I would say, well, let's look at what it actually does, and then oftentimes it was an understanding of, I see now, why you want to do this. I still don't agree with you generally, because I still don't agree with you, but thank you for explaining it to me. And of course, there's always a few that don't feel like you should have any restrictions whatsoever. And so you're never going to convince them that this will be a step in the right direction on public safety. So
this isn't restricting anything because it's already against the law. It's already against federal law. So we didn't create any new crimes. And this was an issue where, and there was a public forum, and people came on both sides and weighed in, and it was very emotional. But I think we did a good job with the bill. I think that, and in the end, I think everybody supported except one group.
Yep, yeah. There was another tough bill that came out of your committee, which was a follow-up to something we passed several years ago, death with dignity, or patient choice.
No, actually, that didn't come out of our committee.
Oh, it
oh
did?
wait. No,
Oh,
that
did
came
that
out
come
of
out
Health
of-
and Welfare.
Okay.
That came out of Health and Welfare, but it was an issue that I worked very closely on and was really involved in it 2 years ago when we actually passed the first bill, and patient choice at end of life.
So we had to revisit that, and again, a very emotional issue. Did you hear from a lot of people on that?
I did. I think maybe because partly being new, I think a lot of people didn't know what my position was. So I think that was why. And for me, it wasn't a difficult issue. I feel like it is a personal choice for people to make those decisions at the end of their lives. And Maggie Lake, one of the few folks who did take advantage of the law in Vermont, was my physician's assistant through Putney Medical Center. And so I had that personal connection, as many of us did. Many of us knew her. And so, but it's very difficult to talk with voters who feel very strongly religious, morally held beliefs about it, and to try to explain how I see my role as an elected official, trying to tease out the religious and moral responsibility. I mean, those were just difficult conversations, and but I'm glad that I had them.
I think for me, the conversation this year was nothing compared to what it was 2 years ago, because we had made the decision we weren't going to make changes to the underlying law. All we were doing was getting rid of the sunset, the amendment that would have sunsetted it and left the immunity there, but
The protections.
no protections. So I think that, I don't know how you did it in the House, but in the Senate it was pretty clear. There was a move to completely repeal the whole thing. Very little discussion or debate. Just zip it, vote the way you're going to vote. And then there was getting rid of the amendment that would have sunsetted it, and that passed pretty. I think actually that passed on a voice vote. I don't remember. I don't think that was
did.
So I think that there wasn't. I got hardly any information. I mean, any letters or.
Well, I know the last time we did this, one of the good things that really came out of the discussions was highlighting both palliative care and advanced directives. And I'm just going to take a minute here to share that with folks at home too, because these are discussions that you should have around having an advanced directive. And the material for that is on the Department of Health website. Also, the Vermont Ethics Network has those forms, and the forms really do help have those discussions with your family. And the time to have them, no matter what your age, as they say, is now. And so they're difficult discussions, and it's one of those things that rose out of these discussions around patient choice that I think are important and reflective of a change in society, that it's time to look at those things, and the time is now, because anybody could step off a street corner and get hit by a bus. We've got a few minutes left. Time to look ahead. Are there things that didn't happen this year, like dental bill, that you'd like to see happen next year?
I'd like to see that happen next year.
What
it would
what is
create
that
a new level of dental practitioner called a dental therapist, which is almost like an advanced dental hygienist. You have to be a dental hygienist first, and then you can take this additional training and 8 new procedures. The dentists, the Dental Society has opposed to is opposed to it. But now a number of dentists have started coming around and saying, this makes sense, I support it. It passed the Senate. It's languishing on your wall, so if you want to take it up next year, we would be very happy to have you.
And just to explain, the session is 2-year session, and this year, things that don't pass
Right.
can still be taken up. After that, a bill would die if it doesn't get acted on.
Right.
So, and I agree. When I worked at Putney Family Services and we ran a free health clinic, one of the largest requests for services were for dental services, and there really is a need for more dental services in the county and in the state. Contrary to what some testimony we heard from the Dental Society, it's a great need. I don't know if it's something you hear about from people.
You know, it is something I feel really strongly about. I know when I first came on, it was very early in the session, both Senator White and Senator Ayer approached me and said, you are going to support this. And for me, it was one of those easy things to think about, because I see it in my kids' school all the time. You see the effects of poverty, and people can't get dental care, and there aren't enough providers who will take Medicaid. We know this to be true. When I look at the kids in my son's school, and I know they clearly do not have, despite Dr. Dinosaur, despite the programs we've put in place, and their parents as well. So this is a real concern.
It is.
And it's a quality of life issue.
And it's probably a little weird to think that it would be a government operations issue. So the reason for that is the Health and Welfare Committee had the bill first, and they just established the need. That's what they did. They said there is a need. Then it came to government operations, because we're the committee that deals with the Office of Professional Regulation. So we do the regulation, we oversee the regulation of all professions in the state. So that's why it came to us for the licensing, the education, all that kind of stuff. So.
Yeah.
And I would love to just give a shout out to Ginny Milkey, former rep, who I know for whom this is a huge issue, and also has worked really hard on it. And I hope that we can get some more movement in the House next year on it.
It's actually something that Senator White has been recognized recently.
I saw that in the paper.
Yes,
Wasn't that nice?
thank you
Yeah.
for bringing that up.
Yeah, I thought that was very nice.
It was really nice.
Well, it's good work you've been doing, along with all
Absolutely.
your other good work, and
Yeah.
it's appropriate that you get recognized
Absolutely.
Thanks.
Looking out for the people who...
for that. Next year, anything?
I've got a couple things that I'm looking into personally, and got some irons in the fire at Ledge Council to do some research. I've had a couple local business owners approach me about having more copyright troll protection in the same way that we have patent troll protections, and so that there may not be a statutory fix, but certainly going to continue to have conversations with the AG's office about that, because as we talked about earlier, we need small businesses not to be spending the resource fighting patent trolls or copyright trolls. And
Right.
So that's personally something I'm looking into, and also had some constituents approach me around issues related to transgender protections in the workplace. And we are on the forefront, but there are some little gaps that people feel acutely in the process of hiring, and feel some of their past history may not be relevant, and yet it will come up in a background check. And so again, may not be a statutory fix, but I want to be having these conversations at the state level to really be thinking about the health of our communities in a holistic way, and who are these people that we need to be looking out for those protections.
It is important to know that if there are legislative fixes for anything, that our deadline for next year is, I think, December 10th.
That's what I've
We
heard.
have to
yep.
have all our requests in. I've already started turning in requests.
So it's not too early for people to get in touch with you?
No.
Absolutely not.
And how do they do that? What's the best way to get in touch with you?
For me, it's either my home phone number,
Okay.
which is 387-4379, and it's in the phone book under Bill and Jeanette White, or my legislative email, which is on the legislative website. It's
First
the same,
initial.
First initial, last name, and then the same for all of us, LEG.
Same. I'm
Yes.
the only Ballant in Vermont perhaps in New England. My phone number is right there, right on South Main Street in Brattleboro. bballant@ledge.state.vt.us. And I would love to hear from folks because, as Jeanette said, I'm learning the time flies by.
It does.
And you have to get your ducks in a row early.
They have to be at the printer by, I think it's December 10th.
Yeah.
So it takes a while to get the bill in the form that you want it. So have to start early.
Oh, great.
And
Thank you for
Well,
taking
thank
the time.
you. It's so lovely always to talk with you, Mike.
Well, thanks.
You're a nice facilitator.
Thanks for the work this year. It was a pleasure to work with you and welcome you into our county delegation.
Thank you.
I think we work well together, and it's great to have you as part of that. Thanks again, too, to the people at BCTV. I think one of our roles as legislators is to inform the people of the work we're doing, and BCTV sure helps make us helps that job become much easier, and I appreciate all the work they do in all realms of what they do in covering the community, but especially in bringing the legislature a little closer to you. So thanks to all the people here at BCTV. And until next time, this is Mike Mrowikci. Thanks a lot.